I'd like to introduce Nikki Beekman, the Executive Director of Chevy Chase House.
Welcome to the Chevy Chase House orientation.
Thank you.
This orientation is for private duty aides and also for employees,
Yes.
for CNAs and LPNs who would be working in care in our community. And the first thing I wanted to do is I just wanted to review the Meridian Senior Living mission statement,
Yeah.
because it's really important to us that PDAs as well as our employees understand the mission and engage with us with the mission.
Understand.
So our mission is that we enrich the lives of our residents, families, and employees through extraordinary experiences, because everyone deserves a great life. And I would add to that our health partners, and
Right.
you are one of our health
them.
partners.
Mhm.
Yep.
Yes, ma'am.
So throughout the it's probably going to be about a 45-minute orientation.
No problem.
I'm going to ask you, I'm going to give you some of our core values,
Okay.
and I'm going to ask you to write them down, although you won't write them down right now,
Okay.
Diana, for the
Okay.
purpose of this
Yes.
filming,
Okay.
because part of the documentation that we had this orientation, or that you viewed this orientation, is that you will have written down our core values, and I just think that's important as well.
Very important.
So our first core value, which really lines up with the mission of assisted living in general,
Right.
is integrity.
Mm-hmm.
And we will act honestly in all that we do, adhering to the highest principles by pursuing a commitment to what is right.
Yes.
So,
Great.
okie dokie. So when we talk about assisted living, really, whether it be in Washington, D.C. or anywhere in the United States, we talk a lot about what is assisted living, the purpose and philosophy of care. And the District of Columbia guides us and gives us a number of points on the philosophy of care. I feel, you'll read it, but I
Right.
feel the most important point of all is the age-in-place model.
Right.
That's why we're here. We want our residents to be able to choose to come and live in an environment that allows them to age in place with additional support systems, whether it be through our staff or a combination of our staff and private duty aides. It's a living program, a housing program. So we have housing, health, and supportive services all in the same place, so that our residents can age in place. We provide activity support with activities of daily living, recreational activities, and 24-hour supervision. And the design of services and the environment acknowledges that a significant number of our residents will have some form of cognitive decline. That is, in fact, one of the reasons that people can no longer maintain their independence at home, is due to the cognitive decline. Program and environment should support resident dignity, privacy, independence, individuality, freedom of choice, decision-making, spirituality, and involvement of family and friends. Residents should be supported to age in place by minimizing the need to move, through reasonable accommodations, and when necessary, through coordination and use of home health agencies, private duty aides, hospice, rehab agencies, and other licensed healthcare providers. So again, our goal is to, and you know this from being a PDA and helping somebody to age in place, is that as long as our resident and family member continue to choose the Chevy Chase House as where they live, we're dedicated to having them age in place with us. So services that we provide, we have, many common areas. Of course, during the pandemic, they're not as well loved, but that is definitely part of what we provide here. We have a beauty parlor, a chapel, a library, a bistro, and an auditorium or a great room. And when we have PDAs working with our residents, it is our hope that the PDAs will help our residents to enjoy the common areas. But the PDAs should never be in the common areas without.
Okay.
Okay. We have lots of different floor plans.
Mhm.
We have 24-hour professional nursing on premise.
Mhm.
We always have a charge nurse 24/7.
Mhm.
And that would be the first person that you would go to
Right.
with any reporting,
complaints,
any
okay.
changes,
Mhm.
or even just to check in.
Right, right.
As you know, our residents have emergency pull cords in their apartments, and they also have a pendant.
Right.
And it is perfectly acceptable for you as a private duty aide to utilize the pendant
Mhm.
to call one of our staff to come and support you
Right.
in the services that you're providing.
Mhm.
We have fine dining, 3 great meals a day served in rooms currently,
Mhm.
and hopefully soon in our dining room.
Mhm.
Housekeeping once per week,
Mhm.
sort of a deep clean we talk about, and daily tidies and trash removal. And speaking of trash, all of our care staff
Mhm.
and PDAs as well, any continence products
Mhm.
that they remove from a resident
Mhm.
and go in the trash, once that care is completed, should be bagged up and taken down to the trash in the lowest level,
Mhm.
the basement.
Mhm.
And during your tour, you'll see that area, although I
Okay.
know you're familiar with it.
Yeah. Mhm.
The trash areas on each floor are not for continence products.
Mhm.
Personal care, we can assist with bathing, dressing, taking medication, escorts to meals and activities, as residents need throughout the day and evening. And again, PDAs are definitely helping with the ADLs as
Mhm.
well. We do provide transportation 5 days a week. We do have a relatively active social program.
Mhm.
Even now during the pandemic, it's beginning to
To start.
get a little bit better.
Mhm.
And when we resume our normal activities, we will offer exercise, music, dance,
Mhm.
hobbies, crafts, really an all-inclusive environment here.
Right.
And we do have some nice outdoor patio areas. Just so you know, we have respite and short-term options as well, where people can come for a month
Right.
and continue to recover
Mhm.
from maybe a rehab stay before they go home. Anytime you receive an orientation or a training, resident rights are always something that we discuss, and so we are going to review them.
Mhm.
And before we do, I am going to talk about our second core value,
Right.
which is care.
Mhm.
And we will demonstrate a nurturing, empathetic, and loving attitude to others.
Mhm.
And we try to make sure that the others are part of everyone.
Yes.
Our healthcare providers,
Mhm.
our coworkers,
Mhm.
our residents, our family members.
Mhm.
So resident rights.
Mhm.
A resident shall have the right to be treated at all times as follows: courteously,
Mhm.
respectfully,
Mhm.
with full recognition of personal dignity and individuality, and with assurance of privacy and the opportunity to act autonomously and share in the responsibility for decisions. And it's really important
Mhm.
when you are in a position of caring for somebody in this environment that we always give choice.
Right.
You know, would you like to wear the red or the blue
Mhm.
shirt?
Mhm.
Or, you know, what would you like to eat today? Would it be the toast or the English muffin?
Mhm.
Sometimes I think when we take care of the same person
Mhm.
for a long period of time, as you do,
Mhm.
we get to know them so well that sometimes we just follow their routine
Right,
without
right.
remembering to provide the choice.
Choice, yeah. Mhm.
How do you go about providing choice, Diana?
We always sit with her after she finished eating, because the receipt always comes with a lunch tray.
Mm-hmm.
So I will ask her, what do you want to eat? So she will choose. She likes salmon. But sometimes she hears some names and she says she wants to try.
Okay.
And then maybe when it comes, it's not what she likes. Then she complains.
But then we can Go to the
Always,
kitchen
yeah.
again and get, yeah.
I
Yeah.
always call the kitchen. She likes cheese sandwich, so
Okay.
I always call and they bring a sandwich. I ask her, what do you want? There's
Mhm.
she always gets what she wants
Good,
if we call the kitchen.
wonderful.
Mm-hmm.
And a resident shall have the right to live in an environment that maintains and enhances the resident's dignity, independence, and respect in full recognition of their individuality and physical and mental capacities or capabilities. The environment is designed to counter loneliness, depression, dependence, boredom, and designed to manage difficult behavior. The environment provides opportunities for socialization, social interaction, leisure activities, and spiritual and religious activities consistent with the preferences and background of the resident. And our environment facilitates participation by arranging for transportation and assisting with communication and social skills and other services. And you play a very important role in that as well. Dignity. A resident shall have the right to the following: a safe, clean, comfortable, stimulating, and home-like environment. Controlled time, space, and lifestyle. It's important for our residents to feel that they can control those things. Free access to visitors of his or her choice. Definitely a challenge with the pandemic, but we've done a lot with that in mind. We have video conferencing, Zoom. We have the table talks. Before the table talks, families visited through the glass.
Yeah, that's what she does.
It's been challenging, for sure. Residents may send and receive correspondence without restrictions, maintain personal possessions, remain in his or her living unit unless a change corresponds to the uncensored preference of the resident or conforms to the obligations set forth in the resident's contract respecting discharge. So we would never, force a resident to leave their apartment. If we have roommates, the resident gets to approve his or her roommate. The resident gets to attend or not attend religious services, to choose activities and schedules consistent with their interests of physical, mental, and psychosocial well-being. The resident is able to interact with members of the community inside and outside and make choices about aspects of his or her life within the facility that are significant to the resident. And very importantly, the resident has the right to be free from mental, verbal, emotional, sexual, and physical abuse, neglect, involuntary seclusion, and exploitation. And those, of course, are areas that we have to always re-educate ourselves on and think about pretty much every day. We have to think about that specific resident right to be free from, mental exploitation. There's a fine line. I always say that the resident is always right.
That's what.
And as long as we, start there, we often end in the right place. And very importantly, it is the resident's right to participate in the development, implementation, and review of plans designed to provide services to residents, including the Individualized Service Plan, the ISP. And as part of this orientation, we will review that, and you will sign off on that. And then every 6 months, when we look to review the ISP, we will be encouraging you throughout this period to let us know of anything that changes as to the care that you provide. Accommodation of needs. A resident shall have the right to the following: to receive adequate and appropriate services and treatment with reasonable accommodation of individual needs and preferences, consistent with their health and physical, mental capabilities and the health of safety of other residents, balancing resident health and safety with other residents' rights. To have access to appropriate health and social services, including social work, home health, nursing, rehab, hospice, medical, dental, dietary, counseling, and psychiatric services. All of those services are provided by our health partners. To remain in the current setting, foregoing a transfer, foregoing a recommended transfer to obtain additional services as contracted for by the resident. So, for instance, as somebody ages in place here, we may say you can continue to live here, but you need to bring in private duty aid to supplement what we can do. And that's the resident's choice, one or the other. To engage in a shared responsibility agreement with the community. If they turn down, for instance, certain care that we might feel they need, a certain resident may need. To refuse to participate in any service once the potential consequence of such participation has been explained. That would be where a shared responsibility agreement could come in. To be free of physical restraints. To be free of chemical restraints. And of course, sometimes we have training regarding the wheelchair, and sometimes we see seat belts, which really, which in our setting would never be used. However, in certain settings, that if they're used, they could become a physical restraint. Representation and resolution of grievances and complaints, very important. The resident shall have the right to the following: to designate a person as his or her surrogate, to have their guardian or advance directives or surrogate health decision maker act for them if for any reason the resident cannot act for themselves. The resident has the right to uncoerced consent, meaning we don't force them to say yes or sign. To present grievances and complaints without fear of threat of retaliation, and have them acknowledged and acted upon promptly with due respect. And that is very important, because so often in this setting as an administrator, I hear from family and also from residents themselves that they are concerned that if they express a grievance that, you know, they may be retaliated. And it's almost a built-in fear that our seniors have living in a communal setting. So we have to always reinforce that we work through grievances, we come to a resolution, and there is no retaliation. To have access to an internal grievance and complaint procedure, and to add grievances and complaints to representatives of the Office of the Long-Term Ombudsman. And we have postings, and I can put anybody in contact with the ombudsman at any point in time. Resident has the right to appoint a specially designed person or attorney to represent the resident in any grievance or complaint procedure or appeal, to organize and participate in and hold meetings of resident groups in the assisted living, and invite staff or visitors to the meetings. So when our resident council is going, it is a resident-led group, but they can invite us to participate and show up and ask questions directly to us, of which we then must give a written, or we must respond to. We must maintain complete written records of the filing and disposition of all grievances, complaints, and appeals. And the resident has the right for privacy and confidentiality. The resident has the right to access their administrator and healthcare records on demand, to have their records kept confidential and released only in accordance with their informed, uncoerced consent, to have their records maintained during their residency, to have their records maintained up to 3 years after discharge, to have any case, discussion, consultation, examination, or treatment of the resident to be kept confidential. If for any reason a resident cannot act for themselves, their consent shall be given on their behalf by their designated surrogate. And the resident has the right to full disclosure of contract terms and practices. An assisted living resident shall place a copy of a document delineating the resident's rights as set forth in this chapter in a conspicuous location, plainly visible and easily read by residents, staff, home health partners, visitors, and provide a copy to each resident and resident surrogate upon admission, which we do. So briefly, we're just going to talk about the disaster plan and fire policy. And another one of our core values is passion. We will display an uncompromising intensity in serving our residents and our families. And I hope you see some of that passion represented here. I see that with you.
I do.
Okay, well, we certainly have learned about disasters recently, being in the midst of a pandemic even. So we'll talk a little bit about that with infection control. But just a brief review of our community. We have a stay in place, a shelter in place model. We have cement floors through each level, and sprinklers and fire doors in each apartment. So if there's a fire, as a PDA, the safest thing for you to do is to remain in place in the apartment with the door closed until a staff person comes and lets you know where the fire is and if you need to evacuate to a safe area on the same floor. So your job as a PDA specifically is to remain calm
with the patient.
and patient, and let them know that they're very extremely safe in their apartment. So if you are not in the apartment but you're on the floor and the fire alarm sounds, please go directly to the apartment or the nearest apartment, because even an empty apartment is a safe apartment. And you close the door and you remain there until one of our team members come. Obviously, if the fire is in the resident's apartment, the resident should exit, pull the door closed, and proceed to the point as far away as possible from their room. And that would include going through a fire door. So if the fire door is closed and you're on one side of the fire door, you open it, you go through, you're in a fire safe area. If a resident is in the dining room, you should stay there until given the all clear or until the commander, who would be a charge nurse, tells you where to go. If a resident is in the chapel, they should go to the dining room. If a resident is in the lobby or bistro, they should proceed to the library and wait for the all clear. Very important to understand that we need to get a head count. So even when the alarm goes out, we're asking everybody to remain in place so that we can get that head count. And remember, the elevators do not work in a fire emergency. So it's important that you understand that. Also to know that every apartment in the Chevy Chase house has a smoke detector. It is an alert system in case of fire. The smoke detectors in the apartments are connected to the main fire alarm. If you find fire in the apartment and the alarm is not already going off, you must activate the fire alarms by pulling the closest pull box in the hallway, those little red boxes. To activate an alarm, pull down the front of an alarm box. And please make sure as you walk and orient yourself to the community that you pay attention to the extinguishers and the pull stations. When we do our walkthrough, they'll be pointed out to you. If even a faint odor of smoke is detected, we must notify the fire department, notify the front desk, or call 911. It is perfectly okay for any staff member here or a PDA, if there's an emergency, to call 911. If you find a fire, you must sound the nearest alarm. Make sure the fire department is notified, which they would be by sounding the alarm. You should never try to fight a fire by yourself without first making others aware that there's a problem. Once that's done and your resident is safely behind a closed door, Attempt to extinguish the fire only after sounding the alarm, and the fire extinguishers will work very well for, and should be something that you would go to in the event that you're not already behind a closed door with your resident. And the community staff is in charge during an emergency. You need to follow their instructions. We have, just so you know, we have all of our staff, we have charge nurses and a charge nurse who is the lead charge nurse identified every day. And our training for fire drills and all that is that even when management is in the community, the charge nurse takes over. So they have to tell us what to do. They'll let you know what to do, but you know what to do now. Well, you have. All right. I've already spoken to you about this. Most important thing for you as a PDA is to secure your resident's room by closing all doors and windows and remain with your resident. Okay. So other potential emergencies that we really speak about are communicable diseases, which I'll talk a little bit about. We've been living through it. Mental breakdown and critically ill. So obviously we've learned a lot about infection control, and that's the first line of defense. Every year in a setting where there's many people living together, we typically see a little bit of the stomach bug, we see the flu, and now we've lived through COVID-19, are living through COVID-19. And so what you will find when we're living through a pandemic or an outbreak is that we have designated personnel to care for residents. And that in addition to measures that may already be in place, such as masks, shields, gloves, hand sanitation, hand sanitizers, we may add additional PPE into the plan of action. Certainly, if you witness mental breakdown of one of your resident, you would want to notify nursing staff immediately. At the same time, I know that oftentimes PDAs notify their employer, and that's great, that's super, but at the same time that you're doing that, you must notify the charge nurse and get us involved as well. And then obviously stay calm and help your resident to remain calm. Critically ill, again, 911. No problem, don't wait. Your resident as a PDA has had a change in condition or a change in status or is having difficulty breathing. 911 is never the wrong choice. We have evacuation maps that are located on each floor by the elevators and stairwells. It's important that you become familiar with them. So I'm just going to mention the locations of the fire extinguishers, and you'll have a copy of this orientation. In the basement, the north end of the garage by the maintenance shop, boiler room outside the boiler room door, and in the laundry room there are fire extinguishers. On the lobby level, there's one Legation Street side of the building, back exit door on outside wall. So that would be, Ooh, where am I? Center hall by exit doors, and south side between apartments 123 and 124. And then because each floor is exactly the same, that pattern will follow. Second floor, I messed up. Lobby level. Legation Street, side of building, back exit door on outside wall. High voltage room and alarm switch box, and the exit door by the nurses station are where the fire extinguishers are. Lobby, well, first of all, there's alarm to the right of the front door by the fire alarm panel. And there's also an alarm box across from the dietary office. First floor extinguishers, Legation Street, side by exit door, center hall by exit door, and south side between apartments 123, and 124. And that follows all the way up. Second floor, Legation Street side by exit door, Center Hall by exit door, south side between apartments 223 and 224. And we have these tiers, right? So the 23s, first, second, third, fourth, fifth, they're all the same, the 24s. So I'm gonna ask you to really, pay attention to that and know where they are, so that if you're not looking for them, if we need them. Alrighty. 2 floors that are a little bit different are the 6th floor and 7th floor, and they just have 5 apartments in them each.
Right.
And the extinguishers are on the east side by stairs next to 617 and 717.
Okay.
Alrighty, so we're going to talk about another one of our core values, which is joy.
Oh.
What does joy mean to you?
Happiness. Yeah.
Absolutely.
Yeah.
So we will provide great delight and happiness by engaging our residents, families, and employees, and our health partners in the WOW experience. And what we really want to do is we want to know a little bit about you, and you about me.
Yes.
And connect to each other that way, because that allows us to, feel happier.
Yeah.
Alrighty, so we're going to talk a little bit about the Individualized Service Plan, ISP. So the ISP starts really before a resident moves in, but on the day a resident arrives, the nurse meets with them to finalize their Individual Service Plan, ISP. It is important that you read it, that you understand it, and that you let us know when there's changes.
Okay.
Just so you know, we have a business office, and this is where we direct people for questions about their bills. The front desk, as you know, is open 24/7, and is really where you can get a lot of questions answered. Ordering supplies, finding out important phone numbers, making phone calls for residents, healthcare services. As mentioned, we do have nursing 24/7 in the community, and the charge nurse is where you would go 24/7, 7 days a week to start a conversation about care and or a concern or reporting for the resident that you're taking care of. And one of the ways that you can call some of our staff into the apartment is through the pull cord or the pendant. Housekeeping services, there's a deep clean once a week, and daily we would be coming in to take trash and make sure the towel supply is good. And then we ask PDAs to continue the housekeeping throughout the week. Food service, you can call directly to the kitchen to place orders. We have a menu system, a pre-ordering system happening right now with in-room dining. And once the dining room is back open, we're certainly going to encourage residents to come to the dining room. We ask that private duty aides, when the residents are in the dining room or in a common area engaged in an activity, are not in our common areas. And we also, it's also very important, and that we mentioned that English is the first language of the majority of our residents here. And we should hear English being spoken to our residents. If a employee or a PDA is making a private phone call and speaking to a family member in a non-English language, it should not be in the common areas. Okay. Breakfast, lunch, and dinner, we have the times posted. Outgoing mail, just so you know, could be left at the front desk. You could also have a nice little walk to the mailbox as a activity for your resident. You can order a newspaper from newspaper delivery. Telephones are available through Verizon or Comcast. Cable television is as well, and our residents can have a pet if they would like to. They just have to sign a pet policy and be able to take care of the pet. As you know, we provide, or as you will learn, we provide cars available Monday through Friday, 9 a.m. to 4:30. For pre-arranged appointments, we can drive our residents to and from doctor's appointments or other pre-arranged appointments.
Right.
It's a first come, first serve. And we do make accommodations for a family member or a private duty aide to accompany a resident.
Right.
Recreational activities are typically scheduled 7 days a week. There's a monthly calendar, a weekly calendar, and a daily calendar, and it's wonderful for you as a PDA to become familiar with those and encourage your resident, our mutual resident, to engage.
Right.
The beauty salon's opening back up in a couple of weeks, and that'll be really wonderful. And you can make appointments at the front desk.
Yeah. She really wants that.
I know. Well, actually, so.
I've been washing her hair.
Oh, thank you. Well, there's going to be a notice that goes out either today or tomorrow about the reopening first 2 weeks. All right, so infection control, of course, is something that is of primary importance. We've certainly learned that. No question about it. So, as I mentioned, typically every year, we see a little bit of the gastro, the GI bug. We see colds, coughs, flus, and we are living with COVID-19 now.
Right.
Really important to know the symptoms of the gastro, the nausea and vomiting, the diarrhea, loss of appetite.
Right.
Those are things that you'd be reporting anyhow.
Yeah.
All of these viruses are very contagious, and they're even more contagious in a communal living.
That's true.
We try very hard to make sure that there's no sharing of food, drink, or eating utensils. And as we've all been, not learned, we know it, but as we've all been very focused, hand washing is absolutely the front line. So we should be washing our hands and supporting our residents in having their hands washed or assisting them after using the bathroom, before and after eating, after handling money, after handling raw food or partially cooked food, after hand contact with soiled clothing or other material that is soiled, after the use of a tissue or handkerchief. And we know we see residents that are using a tissue constantly, so that's where the hand sanitizer comes in. And after touching the T-zone, the ears, nose, mouth, and hair of any infected or unsanitary area of the body. So we have reporting that we must do in a timely manner that we cannot do in a timely manner unless our PDAs and our frontline staff report them to us. So we need to report 3 or more there it is. Instances of the same symptoms of residents or staff in a 24 to 48 hour period. Obviously, we're documenting residents' health status to include vital signs with temperature, symptoms, dietary intake. The director of nursing will initiate the data collecting tool. We've really learned a lot about that. And we make sure we have continued observation and notification of similar or same symptoms that would be reported to administrator and the medical director and Department of Health. Isolate and initiate. Symptomatic residents will be confined to their apartments or transferred to a medical facility if needed. All staff and health partners will be reminded of proper hand washing and use of PPE, gloves, gowns, masks, and in the case of COVID-19 now, shields if we're in a direct care area. Continued data collection, initiate use of disposable tableware, and initiate the consumption of fluids, water, Gatorade, ginger ale. Sanitize and separate. The common areas in resident rooms will be wiped down with germicide on a regular basis. Medication carts wiped down daily. Nurses delivering medications will sanitize, so you will not see gloves, but they will sanitize hands after each resident. Soiled linens and soiled clothing will be separated, soiled incontinence products and trash separated, and all group activities, closed dining rooms, and subsequently minimize cross-contamination when there's an outbreak. And we must maintain records of everything we've done,
Right.
and of updated status on residents and staff and health partners.
Right.
And we need your support with that.
Mhm.
So in the event that there is an outbreak, all staff, including PDAs, will be re-educated on hand washing. The use of gloves does not replace hand washing. Minimize the flow of staff between well and ill residents. Remind and encourage residents to wash their hands before and after meals and activities. Any ill staff, including PDA workers, should remain off duty for 72 hours. And of course, health screening is going on right now. Any ill staff and private duty aides must report to the director of nursing at the Chevy Chase House with their symptoms, and obviously avoid communal bowls of fruit, food. Visitors must be encouraged to use hand sanitizer before and after their visit, and children should be discouraged from visiting at all. Family members, and then family members of those residents who are cognitively impaired need to be reminded of all of this as well. Okay, abuse, neglect, and exploitation. Policy and procedure. All right, the policy reads, the community prohibits the abuse, neglect, and exploitation of its residents, and will have a system in place to appropriately respond to any allegation of abuse, neglect, or exploitation. Abuse, an act or failure to act, either intentional or reckless, which causes or is likely to cause physical or emotional harm to a resident. Abuse can be either verbal or physical. Neglect, failure to provide a resident with services or goods which are reasonably necessary to assure the resident's safety and well-being, and which are necessary to avoid physical or emotional harm. And exploitation, misuse of a resident's property, belonging, money, medication, or the intentional taking advantage of a resident's physical or financial resources. And all of those things would be things that you must report to us. You're a mandated reporter the same way all the rest of us are. Sometimes the PDAs, when it comes to exploitation, are the first line of reporters. So we definitely, the procedure is that we provide a copy of our abuse, neglect, exploitation policy at admission to the resident and responsible party. We review it with our staff and our PDAs. For all new employees, the community will obtain the required criminal background, registry, licensure checks, and any other check as required by regulation before hire. Employees and or PDAs will receive training during orientation and annually. Reporting and documentation of any allegation of abuse, neglect, or exploitation. Training will include a review of the consequences for resident abuse, neglect, and exploitation, such as termination, civil liability, and referral to law enforcement for criminal prosecution. Documentation of employee training we must keep, and you as a licensed HHA, CNA? CNA. And we post signs as well. There's signs in the elevators and throughout the building. Reporting, employees witnessing, suspecting, or having knowledge of abuse, neglect, and or exploitation of a resident have an obligation to report immediately to a supervisor. And as soon as practical to the required agency. Employees who report an allegation to the assisted living administrator must assure that he or she has made a report to the required agency. What that means is if you report an allegation to me, you have every right to ask me, did you report that, Nikki? I must report it. And I will report it. You have a right to know.
Right.
if I reported it,
Yeah.
if the community reported it. The assisted living administrator must seek immediate emergency care if needed, remove individuals involved in the allegation, and we do that. We start an investigation immediately. We remove people. That doesn't mean the allegation is founded or not founded. It means that we're going to do a thorough investigation
Right.
and act accordingly. We must notify the resident's medical provider, the resident's responsible party. We must notify local law enforcement of any physical injury, sexual abuse, death, or other crime related to the alleged abuse. We must notify the District of Columbia's mayor and Adult Protective Services. We must notify the Regional Director of Operations for Meridian Senior Living. Notify supervisor management if accused individuals from a third party, provider or vendor. And we must assure the proper reporting to the state regulatory agency, Department of Health, District of, and insurance reporting is completed. And all required documentation is completed within the required timeframes. We report an insurance report to our insurance carrier. And the identity of the resident, accused individual, and person making the report remains confidential unless circumstances prevent it. The executive director will ensure no retaliation against the person making the report occurs. Investigation and action. The administrator will initiate an investigation of allegation within 24 hours. So the investigation must begin within 24 hours of the report. We interview and obtain written statements from employees, residents, health providers, accused individuals. If an employee, an alleged employee, would be placed on suspension pending the outcome of the investigation. I'll assure that the administrator makes sure the licensing board for an individual who has a substantiated finding of abuse would be notified. If the accused individual is a guest or visitor, the individual will be reported to the authorities and barred from the community. If the accused individual is a resident of the community, the resident will be reassessed. The medical provider will be notified, as well as the responsible party, for determination of the most suitable action. The community will follow directions given by law enforcement. The community will securely maintain all documentation related to the investigation. All allegations will be reviewed internally and also as part of our risk management and quality assurance meetings that we have internally. Community will provide training to employees relevant to the allegation to include any information needed for employee welfare, safety, and employee oversight of residents. If necessary or required, the assistant living administrator will provide residents with notifications, related instructions related to security or other information for their safety and well-being. Reporting suspected abuse, neglect, or exploitation. It is imperative that employees, family members, and private duty aides report any suspected abuse, neglect, or exploitation immediately. If the administrator is on duty, it must be reported to the administrator. If the administrator is not on duty, report to the manager on duty or at the charge nurse, who is 24 hours a day. We have a charge nurse. You may report verbally, or you may write what you saw. Be sure if you write what you saw that you give as many details as possible and names of people involved. Write the time and date of the occurrence and print and sign your name and date the document. We will do our best to keep confidentiality, but it is not always possible. We all have the responsibility to make sure all residents are safe and free of abuse, neglect, or exploitation. If you see it, say it. Alrighty, loyalty, another core value. We will be loyal to our employees, our residents, our company, our health providers. Respect. We will respect the rights and dignity of all individuals. Accountability. We will take responsibility for our actions.
Mm-hmm.
And excellence. We will pursue excellence in processes, people, and procedures. One more thing to review with you.
Mm-hmm.
Okay. Well, I'll have to take my glasses off for this. There we go. So this is the agreement that you enter into as a
Right.
private duty aide.
Mm-hmm.
You shall respect the privacy and dignity of all residents and refrain from entering any area without expressed permission.
I agree.
You must be polite and courteous at all times and refrain from using profanity or vulgar comments.
I agree.
You will not interfere with any care provided to the residents, including the resident that you're working with.
I agree.
You will immediately report any changes in resident's condition to the nurse. You will inform the community if you're taking the resident out of the community.
Mm-hmm.
And of course, you're familiar with the AccuShield, the sign in and the sign out.
Right.
And you may not transport any resident that you are not caring for out of the community.
Mm-hmm.
You agree to hold the community harmless for any claim or liability while at the community other than any reckless or intentional conduct caused by one of our employees.
Mm-hmm.
You will report any suspected abuse, neglect, exploitation, or unusual incident. Unusual incidences
Mhm.
are important as well.
Mm-hmm.
To the supervisor, manager on duty, or charge nurse.
Mhm.
You must enter and exit through the front door and sign in and out.
Mm-hmm.
And you must wear a name badge at
Mhm.
all times while in the community,
Mhm.
even within the apartment.
Right.
You'll be given information about available parking areas. So, on the street, move your car every 2 hours. You may not have guests or family in the building at any time.
Mm-hmm.
You may not have animals or pets in the community.
Mm-hmm.
You may not solicit work or care for other residents within the community.
Mm-hmm.
Something that's really important for our private duty aides,
Right, yeah.
especially our independent contractors, to be
Mhm.
aware of. You must dress appropriately,
Mm-hmm.
including the name badge with your title and the company you work for.
Mm-hmm.
And you may not care for the residents. You may only care for the residents that you've been hired for.
Mm-hmm.
You may not be in the common areas. You may not lounge in the common areas,
Mhm.
including the
The
outdoor
outside.
area.
Mhm.
Mhm. We must be aware of what your schedule is,
Mm-hmm.
including agreed upon break times, if there are agreed upon break times,
Mhm.
because many times private duty aides don't have
They don't have break time.
the private. So it's important that we know your schedule.
Mm-hmm.
It's part of the paperwork. You may not use the community phone without permission,
Mhm.
of course, except in case of emergency.
Mm-hmm.
You must report all resident or personal incidents, accidents, or illnesses to the manager on duty, administrator, or charge nurse.
Mm-hmm.
You are only allowed in the community while on duty, caring for the resident.
Mhm.
In other words, when you're clocked in or clocked out. You may only smoke in the designated areas, which is outside and around the back towards legation.
Mm-hmm.
We are a non-smoking building, and you must practice cleanliness and pick up after yourselves and
Mhm.
also your resident.
Mm-hmm.
You may not use community laundry for your own personal use, but certainly you may.
For the
when-
patient.
Right, exactly.
Mhm.
And you must follow all community safety and infection control guidelines. And we reserve the right to ask any caregiver, PDA, to leave the community and refrain from re-entering at our discretion.
Mhm.
So, that's the orientation. I want to
Oh,
thank you
nice.
so much.
Very nice.
Hello everyone, we're going to do a safety tour today. I'm David Manley, your friendly Director of Plant Operations. I'm going to give you a tour of this 145-bed community. This is our fabulous HR office. And here we have the office of our fabulous, super fabulous Activities Life Enrichment Director. If you follow me back here, we have the high voltage electric room. Also where you'll find the fire annunciation panel for the main building. Here we have our telephone control room. Also where we have our Daikin main control panel, which controls all the ACs in the building. There's a total of 7 fire extinguishers on the lobby level. There's 5 in the kitchen. There's 4 on floors 1 and 2, 3 on floors 3, 4, 5, and then there's 1 on floor 6 and 1 on floor 7. Here we have our main lobby, where we have our 2 main elevators. And also on the other side of the building, we have our large freight elevator. Let's see. This is our administrator's office, our lovely administrator, executive director to be exact. We keep all chairs in the building during these times. Make sure that everybody's 6 feet apart. We have our break room currently closed off to residents. But once the pandemic is over, I suppose everybody will be able to get cozy again. We also have our marketing director's office. All right, here we have our annunciator panels for both sides of the building. These will let you know any alarm that's going off. You can silence the alarm here as well as reset the alarm here. Here at Meridian, we truly value safety. If you don't know how to use a fire extinguisher, it's your lucky day. Get to learn right now. First thing you do is pull the pin. You aim at the base of the fire. You squeeze and sweep. Follow me, we'll go back to the kitchen. This is our lovely, lovely dining area. Follow me, we'll go check out the boiler room. And also our laundry service. Here's our lovely boiler room. We also have an AC unit up in there. Welcome to our laundry facility. 4 commercial dryers, 4 commercial washers. Here's Miriam. One of the best laundry attendants I've ever met. All right. This is where we get our water. This is where it comes into the building. This right here is a ball valve. Whenever it's parallel with the pipe, that means it's open. When it's perpendicular? Oh yeah. Whenever it's perpendicular with the pipe, that means it's closed. So in case of a major flood due to the supply system, we would just hit this over and make it perpendicular with the pipe. And it's always a good theory to close them all just in case this one isn't fully holding. This right here is our main circuit panel for the new boxing gym. And also most of the basement lighting that you see down here. This right here is our main shut-off for the gas on this side of the building. All right, so this is the gas cutoff for this side of the building, which also controls the lanterns at the front. And there's a little valve right here. This valve right here, just like a water valve, when it's parallel with the pipe that it's on, that means it's open. So to turn it off, boom, just like that. All right, welcome to stairwell A. Here we have our main shut-off for sprinkler valve. If this sprinkler accidentally goes off, it comes out at an alarming rate. So you will always turn this clockwise in order to shut it off. And counterclockwise opens it back up. Here at Meridian, we enrich the lives of our residents, families, and employees through extraordinary experiences, because everyone deserves a great life.